If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the weirdo alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist. That'd be you, Dr. Scott. Yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. Now, listen, we've got an amazing show today, but first we got to get the plugs in. Don't forget to go to stuff.drsteve.com. That's stuff.drsteve.com for all your Amazon shopping needs. Helps keep us on the air, to be perfectly frank. So please use that whenever you need to shop online, and you can scroll down and you can see all the different topics and products that we talk about here, including the Rode instrument tuner. It's a robot. It's an actual robot that you hold in your hand, and it will tune your stringed instruments for you. It's amazing. Check out tweakedaudio.com. Offer code FLUID, F-L-U-I-D, for 33% off your purchase. The best earbuds for the price and the best customer service anywhere. If you want to lose weight with me, go to Noom, N-O-O-M, .drsteve.com. It's not a diet. It's a psychology program. You will lose weight if you do the program. And if you go to noom.drsteve.com and sign up, you get 2 weeks free. And then if you decide that you're going to continue it, then it's just a 3-month program, and then you're done. And then you can keep the app and use it for all the things that you would use it for. Anyway, noom.drsteve.com. Check out Dr. Scott's website at simplyherbals.net. All right. You may have noticed me putting on my best radio voice. That's because we have we have a true great in the studio today. Ladies and gentlemen, late of the Don Imus Show and currently of the Rob Bartlett Comedy Hour, ladies and gentlemen, Mr. Rob Bartlett. Hello, Rob.
Dr. Steve, how are you? I was actually quite impressed with the voice. I was going to suggest you might want to think about
doing some
voiceover work.
No, the problem. Well, I would love to do that. I don't think I have the patience because, I got offered a thing to read an audio book. It's like, I'm not reading this fucking book. So yeah, I just I don't have. I'm better off being a doctor with a good radio voice than a radio person that has no ability to actually entertain anybody. In my opinion.
I would disagree, but
thank you. Sir. Well, hey, let's. Thanks for being here, man. We've talked about doing this for ages. Mm-hmm. I'm looking at a picture of you and me, and then another picture of you and my family and me when we were in the studio. And I can't remember if it was Opie and Jim or if it was actually Opie and Anthony. Do you?
I know Jim was in the studio.
Yep.
I don't remember if it was Opie and Anthony. It might have just been Opie, but
yeah, I can't remember.
It was Opie and Anthony. I think it was Opie and Anthony.
And
I think it was Opie.
Oh, I think so too, because it was pretty long time ago. And at that time, we were on the air at 5 in the morning on Mondays. And that was when I was amazed, Scott, that this Rob Bartlett, who, listen, before there was Opie and Anthony and before we could get Howard Stern, I listened to Don Imus every morning. And, this guy's voices and the bits that they would do were legendary to us. And then I've got this guy sitting here who was a hero of mine. He says, "Oh, I know your show. You're Dr. Steve." And so you used to listen to us on the way into Imus in the morning on Mondays.
Yeah.
Is that what it was? That was crazy.
Yeah. I used to drive in and listen to you guys. It was great. I mean, it was so entertaining. I mean,
wow. Thank you. You don't have to. You don't have to lie, but
it was 5 o'clock in the morning. So
I get it. But so that amazed me. That first off, I never think anybody's listening, much less somebody that I actually admire. So that was really cool, and I've been wanting to just have you on just so I could talk to you for an hour and have an excuse, and But anyway, So you're doing the Rob Bartlett Comedy Hour.
Rob Bartlett Radio.
Oh, sorry, the Rob Bartlett Radio Hour.
Yes.
And
Radio Comedy. Just hang on now. The Rob Bartlett Radio Comedy Hour.
Got it. Okay.
All right. I mean, you're a doctor, for crying out loud. How hard is this?
It's very difficult. And so the Rob Bartlett Radio Comedy Hour, and this is sort of the 2021 version of Firesign Theater, kind of thing.
Yeah,
right?
kind of.
Yeah.
It started out, it was, we used to simulcast it on Facebook Live. It was a visual. I had this idea of combining Saturday Night Live with the old, like Jack Benny show, where the actors would stand in front of microphones holding scripts,
Sure.
And doing sketches. I had a whole troupe of people, some really, really talented people. Megan Samard, Steve Mecca, Mandy Lee Thompson, Alyssa Alter, Whitney.
Wow.
I can't remember her last name now. She's great.
Whitney Cummings?
No. I almost said Cummings.
That was Whitney somebody or other.
Anyway. Whitney Johnson, and I believe. Anyway, and I co-wrote it with a guy, Andrew Smith, who used to be a head writer at SNL, and a dear friend of mine. And we would do this every week, and it was a lot of fun. And we had a musical guest every week, and but then we wound up having.
And you were doing this in an actual studio at ABC, right?
ABC had it like a broadcast stage where they used to do live stuff on Facebook Live and with cameras and whatnot. So every Monday night they would let us use it.
That's
this
cool.
was after I'd left ABC, after Imus in the Morning went off the air, and they removed me from the air. And we did it for a couple of weeks, and then they said we couldn't use the video studio anymore. So then we just used a radio studio, one of the old radio studios, and just did an audio podcast.
Sure.
So we did it in the studio, but we had no live audience. That was the best part about doing it live on Facebook. We had a live audience in the studio with us.
Sure.
So we got some reactions. And then we did it in the studio for a while, and then they gave us an hour on Saturday nights to do the show. And we used to do an edited version and then an uncensored version for the podcast. And then I guess another doctor who wanted, to or something, My Pillow guy or somebody wanted to buy an hour on Saturday and we decided to buy hours, and so we were out, and so we were just doing it from the studio for the podcast. And then they said we couldn't use the studio anymore because there was an insurance problem or something like that, and so now it's just me from my bedroom. So I'm doing all the voices, effects, and all that crap myself.
No, I think that's great though, but it's not the same.
It isn't the same. It isn't the same. And as such, I actually got so tired. I haven't done one now since December. So I've been really, really lax. But now I think after this, we get a little bit of publicity, I'll start up again. Actually, I'm working on something now. It's a throwback to the old Imus in the Morning days. Back when we were on NBC, he had discovered through his urologist what he thought was a third testicle, but was actually, I guess, a fat deposit or whatever it is.
Okay.
So, but we named him Tres Huevos. And so I wrote this whole series, whole series of this Zorro-like character named Tres Huevos.
Sure.
You know, he had his own thing. Out of the night comes a frightening sight. It's the man known as Tres Huevos. Tres Huevos. One more than the average amount. Tres Huevos. 2 strikes and he'd have a full count. And so I'm bringing that back. The legend of Tres Huevos.
Oh, that's too great.
Oh, I love that.
Yes, it means 3 eggs, by the way, Dr. Scott, if you're not fluent in Espanol.
Thank you for the
gracias.
And, so eggs being a euphemism for testicles, because tres testículos would not be a great character name.
Well, you can't write a song about that either.
No.
It is a
Uh-oh.
It is a musical.
We're losing Rob.
Uh-oh.
There you are.
There you go. Okay.
It isn't musical enough, Testiculos.
Yeah, right. No, how would you do that?
There was actually a line in the first episode when the father, Tres Huevos' father, says, tells him that he was born with the sign of the 3, and it makes him very, very special. And Imus was playing Tres Huevos, of course, and Imus goes, "You're nuts." And the father says, "No, mijo. You're nuts."
That's a great Imus, by the way. I guess after working with him so long, it would be crazy if you didn't have a good Imus.
No, tears.
That's so good. That's so good. But you're also, for those who want to be stand-up comedians, you're doing a thing with them called the RB Studio.
Yeah, I decided that, and this came about during lockdown, it was... There's no way to perform really anymore, and no way of making money anymore. So I thought, why don't I pass on some of my expertise and do online, Zoom coaching and in stand up and also acting. I've been coaching people with acting and some of the musical theater people who have auditions and whatnot, and they bring their song, and I work with them and teach them how to, add some acting techniques to their song, and I have them do the songs as monologues, so that way they get a feel for what it would be like if it was actual dialogue. And actually, one of the students, young 16-year-old boy from Belfast, auditioned for a casting agent and got it while he was still on the phone with her. After he did like a live audition for her, and she signed him immediately. So it'll be like everything else. He'll get big and he'll never write, he'll never call, and that'll be the end.
Right. Like Opie and Anthony, you get them when on the way up, and then you get them again on the way back down.
That's always been my philosophy in show business. It's like be nice to the people on the way up because you might get a chance to open for them on the way down.
There you go. Well, if someone wants to do this, how would they get in touch with you? You might as well get all the plugs out of the way at the beginning, and then we can do medicine.
It's the rbstudio.com or Robio at the rbstudio.com.
Okay.
If you want to just shoot me an email. It's ROBIO at the rbstudio.com.
Awesome. Yeah, good. Well, I am usually the one that when something happens, I'm the one that gets F'd. This is the first time that something catastrophic has happened, and I've actually been okay because, the medical profession, we still had to work. Matter of fact, we were kind of, even if I didn't want to work, I would have been compelled to work because there was a shortage there for a while. Things are calming down now, but yeah, I cannot imagine owning a comedy club,
a music hall,
or a music venue or something. Like, can you? I mean, you can imagine. I can't imagine it because every single one of those sorts of businesses is somebody's dream. They had the dream to have a comedy club or a music venue and hang out with musicians or play or do all that stuff, and that's just the kind of business that absolutely just has been shut down. It's tragic.
Yes.
Yeah, I had done a thing with. They were going for a Guinness Book of World Records. Two comic friends of mine, Richie Byrne and Mark Riccadano. They do a podcast, live video podcast every week on StreamYard. I don't know, StreamYard, I think. Anyway, and they tried to break a Guinness World Record for the longest comedy podcast, and they actually did it for charity. They, got people to donate, and they were on for, I don't know, 60 hours, 70 hours.
I'm sure it was hilarious by hour 59.
Well, no, because it was this rotating bunch of comics.
I thought they did all by themselves.
Yes. And so they would do material, or and so I popped in a couple of times over the weekend, and he had guys from England, which was a very interesting perspective, whatever, and. I realized that not just the ability to perform was something that I missed, but the camaraderie. It's like, you miss your tribe.
Yeah.
I miss just sitting around the table,
just shitting on each other.
Yeah. I mean, shooting the shit, and Voss was on. I was able to shit on him, and then he got me back. He hung up on me. It was just great. It was really, really great. And I realized how much I had missed that part of the business.
Yeah, I can't imagine. And, the one benefit for me has been that most of my meetings have either been canceled or gone all virtual, but that doesn't really work that way for this business. And I see, I don't know how Noam is keeping the doors open. Noam, I'm sure you know Noam Dorman, the owner of the Comedy Cellar and the Fat Black Pussycat and all that stuff. I don't know. How, unless he just has this huge bankroll, how he's keeping that going. But, it'd be tragedy if places like that just close down and don't come back, because I hear in Manhattan about 60% of the small businesses are gone and they're never coming back.
Mm-hmm.
Yeah, it's very, very true. I mean, a lot of comedy clubs I know are trying to do virtual shows.
Yeah. How's that going?
One of my friends did it over the weekend, and I'm curious to find out. There was also another comic I knew who was doing, actually it's Mark Riccadonna, one of the guys from the podcast, was doing a theater in New Hope, Pennsylvania, and it's this theater that's seated 300, and there were 45 people in the house, and I was breaking his balls and telling him, and it wasn't because
it wasn't because of COVID.
It wasn't a draw in Pennsylvania.
Wow, well, that's really something. Well, are you interested in doing some medical questions with us? Just hang out. Sure. We've got some random questions. We've got some, and you are on the same line as the call thing, so I'll try to work that out so that you can hear everything. Right. And then, but you had an interesting sort of medical question or perspective that you wanted us to talk about, if I remember correctly.
I mean, I have this friend who.
That's everybody. By the way, everyone who calls in, they're calling for a friend. So you're in good company.
No, but this is actually for a friend.
Okay. I know it always is. It's always for a friend. I get it.
I swear. How to describe it? The penis is playing peekaboo. It's up inside the body. And it's even when it's not cold, and it's difficult to pee sometimes because it's you got to kind of like yank it out. I mean, I got a pair of tweezers, and I'm trying to because
you mean your friend.
I already have a problem. I'm not working with much to begin with. I'm hung like a salmon. So
is that good? I don't.
Have you ever seen the penis on a salmon?
I have not.
Okay,
so that answered my own question, didn't it?
Exactly. And so and so it's like it's up inside. It's like why? And what do I do to fix this problem?
For your friend, you mean?
For my friend,
yeah. So the first question is your friend at his? I'm going to assume it's a guy. I'm making an assumption, but is your friend at his ideal body weight?
Don't think so.
Okay. Because I'm sure you're not aware of this, but there's a thing called Dr. Steve's rule. And Dr. Steve's rule is that every 35 pounds of weight that you lose, you regain 1 inch of penis length. And there are some people that have a pubic fat pad that is luscious enough that they actually start with negative penis length. That the penis is retracted somewhat inside the fat pad. So with 35 pounds, let's just say it's an inch back. You lose 35 pounds. Now it'll be even.
Now you're neutral.
Then you lose another 35, and it'll be an inch out, and then another 35, another inch. Now, there's a limit to this. That relationship's only linear for part of the curve, right? Because I mean, if you lose 350 pounds, that's no guarantee you're going to have 10 inches of penis length. But you'll optimize the closer you are to your ideal body weight. So that's the first thing. The second thing is that there are some people that have a very profound and powerful cremaster reflex, and the cremaster reflex is the shrinkage. The George Costanza. It's the shrinkage. The reason the body does that is for a couple of things, is that you can't procreate if you don't have your testicles and your penis all functioning and intact. Mm-hmm. So the body will gather them up during times of stress and particularly cold weather. And in some people, it just never lets go. It just holds on to them, and it takes an act of Congress to relax the junk enough so that you can see them from the outside. And it may actually be an evolutionary advantage for some people. If you were jumping over tiger cages for
you don't want anything dangling below while you're jumping. Yes,
exactly.
Yes.
So so in those folks, the cremaster reflex and the other function that it serves is to keep the testicles at the proper temperature. So you can only make sperm when the testicles are about 3 degrees below body temperature. Why? I don't know. That's a question. When I'm sitting in front of our creator and it's Q&A time, that'll be my first question. Why would you make it that way? But anyway, so it has to be 3 degrees below body temperature. Well, the only way to do that is to drop it between the legs. And there are
you can also teabag it in like a cold drink.
Yes,
I mean, would help too, I would think.
Well, if you teabag a cold drink, now it's gonna. Well, that's true, but then it will retract even more at that point because now it's got to raise the body temperature.
Gotcha.
So when it's retracting, it's trying to raise. When they're drooping, it's trying to lower the temperature.
Okay.
Now you'll have some people that will get varicose veins of the scrotum. And that's called a varicocele. And when you reach down there to examine your testicles, instead of feeling testicles, you'll feel what feels like a bag of worms. And that bag of worms actually enlarged, dilated veins, or aka varicose veins, just like in your legs. And those are no longer able to be heat sinks to draw heat away from the testicles. And when that happens, the testicles they'll keep drooping farther and farther in an attempt to lower the temperature, but they can't do it. And those people will become infertile because the testicles then attain body temperature and they can't escape it anymore. So, there's all kinds of interesting problems to do with our testicles. But in your friend's situation, the first thing I would do is have them attain their ideal body weight, and then we'll see what's really going on. Mm-hmm. Because they may have a good, nice, meaty 6 inches, and it's just buried in that pubic fat pad, and until they lose weight all over, it's hard to lose weight in one part of your body.
Mm-hmm. Gotcha. Right?
I
can't believe when I was looking up, what am I going to ask him?
No, that's a good one.
Strange penis conditions.
Well, and you remember Sam Roberts, the young man who's now on the morning show on Sirius XM, channel 103. And he had, and I'm not talking out of school because he talked about this a bunch, a thing called phimosis. And that's where he had normal, meaty, flaccid penis, but the foreskin was so narrow that when he urinated, it would balloon up, and then it would just dribble out the end. And in a situation like that, that's not tenable. And he couldn't retract it to clean it. He couldn't retract it to have an erection. Just a mess. So
basically, what you're saying is Sam was not Jewish.
That is correct. At least not observant. And but he did have an adult circumcision, though. He said it was the most painful thing that he's ever experienced. I don't think Sam's had a lot of pain in his life anyway, but I think when they take your foreskin off as an adult, it sucks.
Well, there's one more thing I think that's a little bit more painful. I had read somewhere where as a form of birth control, and this speaks to what you were saying about the temperature of the scrotum. When I used to put my dick in a microwave to heat it up.
Exactly.
That was pretty painful.
Exactly the same thing.
But
What the fuck?
my wife didn't get pregnant, so it was it worked for me.
Fair enough. And
But the problem is that it gets hot, it gets bubbly, it doesn't get crisp though. You can't get it crisp in the microwave, and I blame the school systems.
Fair enough. I think the school systems are partly to blame for that. You have to have that little silver thing under it to get it to crisp up, and even then it'll only just be the bottom.
Maybe you should try an air fryer.
There you go.
There you go. That might do it.
Much better idea.
You don't want an oil burn.
I'm going to have to give Dr. Scott one of these.
Give yourself a bill.
All right. I think you're absolutely right.
I thought I had a choice between that and the Peyronie disease. I thought those would be the two interesting things that I could bring to the table that might be funny.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
I think I chose the right one. That was good.
I think you did. Peyronie's is a good one to talk about.
If you want to come on the Dr. Steve Show and you need something to talk about, I suggest you Google strange penis conditions and see.
Well, see, when I go on someone else's show, if they invite me on, I have really nothing to offer. I mean, I'm not funny. I'm not glib. I'm just terrible. But I know will make them puke, and so I'll have them Google image. I did this on Chip Chipperson's show, and it was just going nowhere. I said, here, Google image this, and I gave him a couple of things to Google image. One of them is a thing called oral myiasis. And I would advise everyone listening to this right now to don't Google image that. But it will always get people puking. Basically what it is it's, maggots growing in people's bad dental care. And the pictures are absolutely horrific. And it works for me because if people are puking because I had them look at a picture, it's funny. But I don't have to be funny. That way the material is funny. But anyway, no, that was actually, and we should talk about Peyronie's disease. It's been a while since we've discussed it on this show.
Well, I haven't heard anything about it since Bill Clinton. I mean, he was the most famous guy I know. And
that's right. That was how
how would you describe it? Like, what exactly is it? I mean, it's a curvature, right? But
it is, but it's most people have some curvature. There are very few penises that are perfectly straight, although seeing some porn, I've seen a few of them. But most people's penis when erect, will curve to one side or the other slightly. And Peyronie's penis, however, is something different. That's generally happens because of scar tissue on the semi-elastic sheath around the shaft of the penis. So if that sheath was perfectly elastic, when you filled the penile cavern, the caverns up with blood, you would just get a balloon, right? You get a spherical mass that would be just squishy, and that wouldn't be very much fun to have sex with. So the penile shaft sheath is elastic in sort of the axial direction, a little bit in the girth direction, But then it attains a stretch that it can't go beyond that, and then the more blood you pump in there, the harder it gets until you can't scratch it with a a cat can't scratch it. That's the way we would say it in Tennessee.
Yep.
And but that sheath is semi-elastic. If you get some scar tissue in that sheath, where it is now no longer elastic, what's going to happen? It'll enlarge everywhere except there, and so it will bend in the direction of the scar tissue. Now, how do you get scar tissue in your sheath?
That was my next question.
I will tell you how, my friend. You're a little bit drunk, and your partner, your partner of your choice, is on top of you so that you don't have control of the thrusting, and you're laying there sort of passively, and this person is thrusting, and then your penis is not fully erect, so it's a little bit malleable, and then they thrust down with the penis a little, maybe it's not well lubed, or it's half in and half out, and it bends your erect member. And when that happens, you can get a fracture. Not always. A fracture is horrendous, and you'll have intense pain at that area with swelling as the blood starts to pool around there, and it's an extremely painful and big, giant sort of hematoma penis,
and is an emergency in most cases.
And that's a medical emergency. Don't be embarrassed. People will admire you for actually having an injury happen during intercourse. So if you're worried about being embarrassed or humiliated at the emergency room, don't. Definitely go. But and if you get that, you will always get scarring in that area. But not always, though. Sometimes it'll just bend and you'll think it's no big deal. And then the trauma from the folding in half of the penis over time will set in some scar tissue or fibrotic tissue in that where that crease was. And so in those people, they won't even know. And then they'll just notice a month later, gosh, every time I have an erection, it's painful and it's bending 90 degrees or 120 degrees to the right or the left. And it used to be we didn't have a good treatment for that. They would give people these turnbuckle things where you have a sheath that goes around the base of the penis and one that goes around the Roman war helmet. And then you'd have turnbuckles on there, and you would turn them a little bit more every day. You had to walk around with this contraption on your cock, and it would, in an attempt to stretch it back out again. That's one thing that you could do. And if you can catch it early, after a fracture, sometimes you can get it to heal straight that way. But the other...
See, fractured penis. I never knew that you could fracture a penis. I mean,
and fracture's kind of a
conversation starter. I mean, good at parties, Want to sign my cast? I mean,
well, fracture is kind of it's a misnomer. It's not really fractured. It's more ruptured. But because there's no bone there, there are some animals that have bones in their penis, but humans, thankfully, are not one of those.
So bone is a misnomer.
Yes, exactly right. Right. It's bone-like, and or bonoid, or what would it be? What would be
bone-esque?
Yeah, bone-esque. Thank you. That's the word I was going for. I'll give
yourself a bill.
You probably can't hear that. That's Opie saying, "Give yourself a bill."
Give yourself a bill.
So those anyway. We do have treatments now, though.
Okay.
And the treatment is a couple of things. There are some drugs that you can use. One of them is a calcium channel blocker called verapamil, but the one I'm really interested in is collagenase. And what that is it's an enzyme that will break down scar tissue. So you go to a urologist, they find the scar, they inject it with this stuff, and then you can use the turnbuckle, or you can just use some stretching techniques.
Or a fancy cast.
Or fancy
That's a good idea.
cast.
I like that.
And they'll dissolve that scar, and they can even it out. Now, a little bit of curvature is actually a pretty good thing.
Yes.
And here's why. It gives you the illusion of girth. So if you're a needle dick, but you have a penis that curves to the right or the left, when you first, let's assume that you're putting it in a vagina. It could be any orifice of your choice, but we'll just, for the purposes of this discussion, we'll say vagina. And so when you insert it, you're going to be, let's say it's curved to the left, or to the, it doesn't matter, curved to the left. You'll be putting some pressure on the left vaginal wall. Then as you continue to insert, now that middle curve is going to start putting some pressure on the right vaginal wall. Right. And then when you get all the way in, it's going to be curving back, and you're going to get some more pressure on the left vaginal wall. And to the brain that's attached to that orifice, it's going to give it the illusion that you've got a much girthier penis in there.
Right.
See, the ideal situation, I guess, would be that if it curved upwards, then you have the G-spot stimulator already built in.
And I would give you another opie drop, but it just seems like it would, it's going to be
redundant.
Start sounding redundant if I keep doing that. That's exactly right. You're a genius, sir.
That's why I love your show, is because you can learn things.
That's right. See, these are all important things. I remember Bill Burr making fun of us when we did a bit where I had one of my friends come up and taste urine to see if he could tell who was diabetic. And it was a great bit, but it was pretty sophomoric. But and that's, by the way, why doctors invented urine dipsticks, or at least requested that they be invented, so we didn't have to taste urine anymore. But it was a very successful experiment. But Bill Burr said, we're going to be at a party tonight. We're going to be telling people, oh, well, did you know diabetes means siphon in Greek? So you do learn some things.
Hey, I've got. Can I throw this in there?
Of course.
If we're talking about painful penises, I would like to talk to somebody that had an adult circumcision, right?
Well, we know. We have a friend.
Well, I know, but
okay.
And compare that to someone that's also had a cystoscopy, which is worse.
Which we've had.
Right, which you and I both had. What would be worse?
Okay, so...
Lord have mercy.
So, Dr. Rob, Dr. Scott and I both had cystoscopies where they take a fiber optic scope and stick it up the urethral meatus, a.k.a. the cock hole, and they look around in there. And these jackasses, and for the urologists out there, you know who you are, they take this little fiber optic scope and it's
not little.
When it's going up your penis, it seems much larger than it is, but it's still pretty small. But they'll take numbing gel and they'll put it on this thing. And they'll say, we're going to, give you a little numbing gel. That's for them. That's to make them feel better. It doesn't make us feel any better. Matter of fact, I think it makes it worse because it made it burn that much worse on the way in.
It gives you the illusion it's going to help, and it does not.
And then you feel like you're pissing razor blades, even though you're not actually urinating at the time. Now, I don't want to scare anybody away from having this.
It's a good test.
Having the test done, and even as uncomfortable as it is still better than the things that they're looking for. Yes. So, we're being funny, but don't not do it just because we're saying it sucked, but it did suck.
Oh, it's horrible.
But we had a friend, Jefferson the Shyster. He's a lawyer that used to do legal stuff on this show and also just make horrendous jokes. And he had an adult circumcision, and the method that they used didn't hurt him at all. He played softball the next day.
Yep. Hell no.
So they are getting better at that. And so anyway, phew.
Oh, man.
Enough with the penises.
That's what I'm talking about.
Enough with the penises.
I guarantee you this will be one of the highest rated shows you've done.
Of course.
You can't lose with the dick.
No, you're absolutely right. Let's you want to take some phone calls?
Yeah.
All right. Let's see what we got here. Oh, hey, we got one for Dr. Scott. Let's let him. I'm going to pot you up just a little bit so you can hear this, Chairman Rob, and then we'll go from there. Let's see. There it is.
Hi, Casey. Can I talk to the guy sitting beside you, namely Dr. Scott?
Oh,
anyway,
that's funny.
Got a question for Scott.
Did you get it? He said, "Hey, Tace, can I talk to the guy sitting next to you?" They all think they're talking about me, but they's talking about you, Dr. Scott. That's Stacy Deloach, everyone.
Yeah,
give him one of these. Okay, all right, enough of that. Okay, here you go. That's my one voice that I can do, Rob, is the redneck asshole.
Cup therapy. I saw a YouTube video about that, and I remember Michael Phelps one time there was a big question about all these dots on his back, and it was about cup therapy. Does that actually work as a Chinese medical treatment?
Or any kind of medical treatment. So what's the answer, Dr. Scott?
Yes.
Okay. Next question.
Yes, next, please. No, it can work really well when done properly.
Well, tell us about this, because it looked. Michael Phelps gets in the water and he's got these circular, marks on him. I don't know. Are they bruises?
They're bruises. That's exactly what they are.
So tell us the procedure what you actually do, and then tell us why you do it.
Sure.
And then try to make up a reason why it might actually work.
Hey, the old school, and the way I was trained, we took these glass balls, which was what Michael Phelps had, and these are these glass globes. You put a little 1 drop of alcohol in there, and you light it, and it creates a flame. That's right. It's a little teeny explosion, creates a vacuum, and you put this on these sore spots, right? And
okay, so you're burning off the oxygen, and it leaves
vacuum.
when you throw it on there, and it's heating up too. So as it cools down, the air will contract
and
that's
pulls
left
the
in
skin.
there, and it pulls the skin up into the cup.
Yep, pulls the skin up into the cup, and that's one
Seems
method.
incredibly dangerous.
It is. I don't do that. I don't do it. It's just too easy. And if it slips and falls off, then that glass cup falls in your floor, and you have glass every damn where.
Yeah, and fire.
And fire. Well, and here's the thing too, Steve. If you missed the first time, that didn't stick, so that you put another drop of alcohol in there and you light it again. Well, the glass starts getting really hot. I don't do it like that.
So how do you do it?
We have these little plastic suction cups. You suction them up there, and then you can control the amount of pressure putting on the skin.
Okay, wait a minute. So you got a cup, and it's got some sort of
a little suction device on top. Yep.
Okay,
and it's got a little trigger. It's a trigger mechanism.
So each cup has its own suction thing, or you've got a suction thing that you attach to it?
Yeah, a suction cup that you attach to it. So let's say I've got 20 cups.
Yep.
And you just go one, suck, and you pull it up until the person's comfortable, until you've reached what you would call a therapeutic. A pull.
Okay, that's a
which
big
is a
word.
relative term. I know that, but I do moving cupping. I put coconut oil on the skin. So, like let's say if our buddy Rob comes in with a muscle spasm in his back, I put some coconut oil, rub it in, make sure the music is playing, and I pull those cups. Put a cup on him and pull it just tight enough so I could slide the cup up and down. I don't
Now
bruise.
that I could see.
Yeah.
We've talked about this before.
Yeah.
To loosen up
the fascia and the skin. That's
layers of tissue, I can see that because how else would you lift it? You can't get underneath it and somehow lift it up.
Nope.
And there's no way that you can lift skin up.
Nope.
But you can with that. Now, that makes sense to me.
It's a perfect balance to massage. I love a massage because the massage is pushing, kneading, mashing, and cupping is the exact opposite. It's sucking, pulling. It's pulling the pressure off the bone. So, if we've got somebody with a back pain and you can feel it's right on a rib, you can just pull the muscle and the fascia and the skin out there. It takes the pressure off the nerve. It works extremely well.
Now, see, that makes sense to me.
Yeah.
What they're saying, and I know Rob saw the same thing, is these circular things all over, and they're saying, well, they're bringing blood up there, and somehow that's anti-inflammatory.
To a certain degree, it's more of a noxious stimulant. But something else I use for cupping for is for a rash or urticaria. I'll actually put a little teeny needle right in the center of a rash, put a cup and pull the heat out of it. It works extremely well. Now, I know you're going to poo-poo that, but it works extremely well. So
does it really?
It does. Yeah, but I don't like putting these huge bruises on people. It takes a while to go away, and you have to explain.
Makes them feel like they did something.
Yeah.
So I have a question, Dr. Scott. Sure. If you have a pain in your neck, getting a hickey would be therapeutic.
That's 100% correct. Yes.
There you go.
And if I can't do it with a cup, I'll do it myself.
So now, guys, you have an excuse.
That's right.
You come home, your wife says, "What is that?" You just said, "I had some cup therapy for my neck."
Hickey therapy.
Do people still do hickeys? I mean,
I don't know. I hadn't had one in a while.
I never did one. You have to intentionally do a hickey.
Do it, right.
And so you're doing that just to basically make your mark on somebody.
Yeah, I don't think I've ever given a hickey to anybody.
No.
Except for a cup. No, that's weird.
Yeah, you're like, this is my property.
Yep.
This is this person. It's with the things all over their neck.
Hey, Rob! I had a guy years ago that had a boil on his head, and I took a little and lanced it with a little scalpel, and then put that cup and sucked the pus out of it. Perfect.
Really?
Right up, yeah.
Well, that makes
blood
sense.
and pus everywhere.
That sounds like a medical procedure that might be beyond the scope of your license.
Nope.
You can take a scalpel and you can lance.
You should those bleeding needles. See, I do bleeding therapy. Yeah, big old. I mean, they're like 18 gauge needles. Yep.
Whoa. Basically, you're going back to the age of leeches.
Yeah, right on. Hey, we did a bleeding therapy on this guy today.
For what?
For stress.
Okay, now we're gonna.
So you're also a barber, is what you're saying?
Yes, that's exactly right.
That's where the red and white barber pole came from. You know, they would take the blood-soaked gauze and they would hang it
Wrap it
outside
around,
on a pole.
Yep.
And that's where you knew where the barber was. And then when they quit actually...
Give yourself a bill.
Give yourself a bill.
There you go.
So we got to... Okay, listen, I've never heard you talking about bleeding
Oh,
therapy.
yeah.
Now, this is a new level of malarkey.
Watch it now.
All right.
There's a 500 years of research on this.
Okay,
I'll
tell
find
us
some
about
research. I'll find some.
No, it's okay. Let's talk about
Well,
it.
I don't have the research today.
Okay.
But I can find it.
That's like Tommy Flanagan. I can speak Russian when I'm in the mood. Check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. Also, it's kind of spelled like simplyherballs.net, so you can remember it. I give Scott a hard time, but actually he and I were partners in medicine a long time ago, and that's how we first met and started working together. And when Western medicine failed one of my patients, where I'd done A, I've done B, I've done C, I've done all these things. I ruled out things that were going to kill him. They still felt like crap. I'd send him to Scott, and he'd feel all these pulses that we don't understand, and he could make a diagnosis that didn't make sense to us, but the patients got a name for what was wrong with them, and 100% of them felt better. Mm-hmm. Afterwards.
It's just because to show you something that's 5,000 years old is there for a reason.
That's right. Yeah. No, I'm and there really is I give him a hard time about some of this stuff, but the acupuncture that he does, there's really good data on that for a lot of different things. Now, if Scott was saying, "Hey, I can cure cancer by putting a needle in your third knuckle," then I would be, we would have a problem.
Yes.
But he's the perfect example of a complementary medicine type practitioner, because we complement each other. You know,
working together.
What I'm no good at, he's really good at, and vice versa.
Oh, yeah.
So what would be the Chinese medicine solution for erectile dysfunction?
Oh, excellent question.
That is a good question,
because there are a couple of them, and Scott doesn't mess with those. But talk about the ones that you do mess with.
We have a couple herbal formulas.
I know where you're going with that.
Yeah, but there are some that have astragalus and ginseng and things of that nature that'll stimulate the energy. Yohimbean root's been proven to help with erectile function. Yeah.
Back before Viagra came out, that's what we used. Mm-hmm. You know, we used what's the injectable one?
Spanish fly?
Yeah, no. Spanish fly just makes you have an itchy urinary tract.
Oh yeah,
so somehow that's supposed to alprostadil. Alprostadil is an injection.
Yeah,
we used to inject that, and it's a vasodilator. And then we would use Yohimbean. That was all we had.
Yep. Rob, I'll tell you, and depending on the case, we have a couple different formulas for whatever the person's reason may be. But and Dr. Steve will tell you this too. A lot of times, erectile dysfunction is a psychological thing. So sometimes I'll give somebody some herbal medicines just to calm them down, and then tell them to go do their thing, and it works out pretty well.
Performance anxiety.
Performance anxiety.
And I've had that as well, that some people just needed to have the Viagra in their back pocket.
Yep.
Knowing that it was there, they would be able to perform.
Because I thought that was how you used it. You just put it in your back pocket.
Yeah.
I started using it wrong all these years.
No, it's not wrong. It actually, there's a subset of people it works just great.
It works.
You know,
that placebo's a good pill to take sometimes.
The placebo,
it's a great drug.
Yep.
The placebo is so important that we have to subtract it from every single drug trial that we do. You know, that's the thing. So and we have practitioners that do certain things, and without saying I don't want to piss anybody off, but there are some therapeutics where you don't even touch the patient. You just wave your hands over them, right? And they'll say, oh, we manipulate bioenergy fields, and we do this and we do that. And it's like, oh, seriously? But they don't want to say that they are manipulating the placebo effect.
Right.
Because somehow that's less important. My argument is the placebo effect is so important that every single study that we've ever done that's worth anything subtracts out the placebo effect, because we know how important it is. So for those people that do procedures that rely on the placebo effect, but they don't want to call it that. I came up with and I actually published an article about this, a substitute term called the cryptogenic therapeutic effect. Means the same thing. Cryptogenic just means we don't know.
Sounds pretty fancy.
But therapeutic means it actually is doing something so that people can say, yes, well, instead of making up some bioenergy field that no one's ever detected, just say, my technique uses the cryptogenic therapeutic effect. It sounds fancy, it sounds scientific, and it's more true. Anyway,
Brilliant.
there you go. Thank you, sir. That's why I told you that, so that you would give me that compliment. All right, let's take another call.
Hey, guys, another question for you. I'm
Same
just
guy.
listening to the news, and they're talking about, I know you're a dog lover, about using canines for detecting coronavirus in people's sweat. And then another one that they've been training up for detecting the virus where they need to do massive cleaning at. Wonder if you could explore that. Bye.
That's fascinating.
That's pretty cool.
Dogs are amazing. The olfactory sense is the first one wired to the brain. So in humans, sorry, I got to get rid of this sound. There we go. In humans, our olfactory nerves are pretty short. It's just enough for us to smell that there's shit in our food.
Right on.
That's basically what it's there for.
Right.
And
protection, right?
So we don't eat something rotten.
Right.
And it contributes to taste as well. If you ever try to eat something while you're holding your nose, you know about that. Dogs, you see their snout for the most part. A normal dog snout is 6 to 8 inches long, and it's all filled with olfactory nerve cells up in the top. And they can detect orders of magnitude better chemical sense better than we can. And so this is very interesting. I haven't seen this research, and that's something you might look up, Dr. Scott, while we're talking about it. But animals have all kinds of interesting properties. I don't know, Rob, if you've heard about the cats in nursing homes. They'll have these cats in these nursing homes, and they'll go visit these people and just hang out in their room, and then a week later the people die. And the hypothesis is somehow the cats can tell that they've got something that other people aren't aware of. And so it doesn't surprise me that dogs can smell marijuana that's been double, triple wrapped in someone's car. How in the hell they do that? That there might be some interesting scent that the virus makes in people's sweat, some byproduct of breaking down the virus that they can smell. Did you find something, Scott?
Yeah, just now, but I'm trying to see if it's a good.
Well, anyway.
I heard that there are some dogs that can smell if a person has cancer or not.
I've heard this as well, and again, just subtle changes in our metabolism may be something that a dog, or you then take that and turn it into a technology. We have sniffing machines, things that can smell scents, but none of them are as subtle or robust as biological odor sensors. What did you find, Scott?
Evidently, all across the world, there are dog trainers that are training dogs to smell COVID.
So, okay, they're training dogs, but are they having any success with it? What's going on?
Yeah, so according to what I'm reading here, it looks like dogs have somewhere in the neighborhood of 300 million sensors in their nose compared to 6 million for humans.
Oh, okay.
Yeah, so Stephen, I'm just kind of scanning this real quick.
So it's an order of magnitude times 5.
Yeah, which
More.
is profound.
Yep.
So real quick, what they're saying here is they actually did a small study. It was in Beirut. 1,680 passengers in an airport.
Okay.
They had 2 dogs that were their top, that they kind of identified as their top dogs. They identified out of the 1,680 people going through this airport in an hour, 158 COVID cases that were confirmed later by a PCR test.
100%?
90. The animals correctly identified negative results with 100% accuracy and correctly detected 92% of all positive
Holy
cases.
crap.
That's in an airport now, which think about the benefit. Think about the benefit of that and not having to do a one of our friends. She's flying to see her mother overseas tomorrow, and she had to have a test today so that she can fly overseas tomorrow.
Yeah.
But just think, if you could get these dogs trained, be able to take them to train stations or bus stations, airports, so people can get to see their families overseas or in some other.
That's amazing.
It's pretty cool. Yeah.
I wonder if they were detecting if those patients were also febrile, because I would want to know how many of those actually had fevers, because I could see a dog being able to pick somebody out with a fever. And right now, if you have a fever and you're walking around, you probably have COVID-19.
Right.
So now, if like 50% of them had elevated temperatures, but they still detected 92% of, or 92% accuracy, that's amazing.
Well, and I can compare it to the way the dogs will sniff seizures prior to someone having a seizure.
Yeah, I wonder about that.
So if you get,
I know there could be subtle things that are happening in the body just before certain people have a seizure, or just electrical discharges where they're getting a little bit of what we would call fasciculation, where the muscles are starting to just vibrate a little bit before the whole thing happens. Sort of like the opposite of an aftershock and an earthquake.
May I say this real quick?
Yeah,
what they're saying, and I just read this too. The way they trained these dogs was they actually took them to a hospital, and they had samples of positive patients who had the nasal swabs.
Yeah,
and that's how they trained these dogs to. Isn't that wild?
That's cool.
That's cool.
All right,
cool stuff.
Well, Rob, do you have a dog?
Yeah, two actually.
What can they do?
Besides annoy me,
bark, hump.
They can lick themselves, which is something I think is worth being a dog just for that.
You know how long I tried to do that when I was 12 and 13.
I still every once in a while when I'm watching TV get the urge just to see if I can, just because I think it's a good party trick.
The answer's always the same, but it would be amazing if you could. It would change everything. Why would you ever pursue a sex partner though if you could blow yourself? I mean, you wouldn't.
No, agreed.
It'd be stupid.
You speak the truth.
Well, listen.
Oh my God!
Like Woody Allen's quote about masturbation: "It's sex with somebody I love."
That's right.
But I've learned, if you use your other hand, it feels like somebody else is doing it. So
that's right. That's kind of is the thing.
Hey, Rob, or if you'll sit on your hand for long enough and it goes numb, and then you do it, then it does. It definitely feels like somebody else doing it.
Yes,
that's
I like
interesting.
That. Yeah, I like that.
I heard allegedly. My friend.
Allegedly, right? Yeah.
We have talked on this show several times about people who have premature ejaculation, and one of the techniques to fix that is to practice edging. Basically, it's edging. You masturbate yourself up to the point where you're going to cross the event horizon where there's no return, but you get up to that point and then you back off, which is hard to do, but it's a good technique to learn how to do. And then I teach them to get like a fleshlight or one of those just gel masturbator things, but don't jack it up and down. Put it on a table that's about waist high, and then just actually have intercourse with it. Where you're standing there and inserting and then thrusting and then practicing that way. And then that more closely simulates actual intercourse than if you're just, jacking that thing up and down. So I don't know why I got off on that tangent. It's still fascinating to me, but it had nothing to do with what we're talking about. But it's uh-oh. Oh, we had one of those Skype moments. Sorry, I missed that whole line. Sorry.
It's a tip I'm going to take with me, I'll tell you that.
There you go. Very good. Yeah, I heard Jim Norton talking about it on his show one day. He said, I heard Dr. Steve say if you take the fleshlight and put it on a table and actually have sex with it, it's better. I'm going to try that tonight. I was like, wow, somebody actually listens to this shit.
How do you fasten it to the table, though?
Well, you just hold it down or just wrap it in a towel or just put your hand over it or something.
Okay. All right.
I mean, I don't know. I'm guessing that's how you would do it. Wink, wink.
Well, as long as you buy a dinner afterwards.
That's the great thing. You just put it under the faucet and throw it up above the medicine cabinet and forget about it until next time. It's the greatest thing in the world. Hey, Rob, thank you for being here. It was a delight.
My pleasure, man. This was just so much fun. It's always great to see you and great to listen to you. And
likewise, man. And we need to do this again, but we need to plug your stuff. And I'm on the wrong script now, so it's the Rob Bartlett Radio Comedy Hour.
Right.
Is it .com or they just search for that?
Just search for that. It's a podcast. It also is a channel on YouTube. I have some video stuff up there as well.
Wherever you get your podcasts, you can find it. And also, if you're interested in being coached by a true coach in show business, check him out at the RB. Tell me the
RB Studio. The RBstudio.com. It's if you want to, be a stand-up comic, or if you want to be an actor, or you are an actor and you are a stand-up comic and just need some advice and help and coaching. And I do audition prep is the thrust of what I. Which is and it seems to be helpful, and I really love doing it. So.
That's the big thing, right? Is getting through the audition. Yeah. Because once you're hired, it's like getting into medical school. Once they accept you, you're pretty much going to make it in that particular job.
Yeah, you just want to show them what you can do, you know. And I think the mistake that a lot of people make in auditions, and I've been auditioning for 40 some odd years, I still make the same mistakes. It's just we fear these things, we get all kinds of anxiety and get so nervous about them, and then you learn that they're really performances. So you just have to prep as though it was an actual performance, and it's just doing research and doing the work.
People fear rejection, so then they end up either not going or they do worse than they would have if they just weren't worried about it.
Exactly.
Can you teach Jim Norton what to do with his hands when he's acting? Because that's his number one complaint. He doesn't know what to do with his hands.
He really doesn't. It's so funny to watch. He'll find something, and what he'll do is he'll find something that he'll use every time he acts. Then too.
Yeah, right.
His little signature. So, that's the guy who has his hands in his pockets all the time. Whatever it is.
Or Johnny Carson with the pencil or the cigarette.
Right. Exactly.
Letterman with the pencil throwing it around. Well, anyway, so it's the rbstudio.com. Check him out.
Yes, sir.
One of the greatest people in the world is Rob Bartlett, and I bet you don't even know, because I know you don't listen to. If you do listen to our show, you don't listen all the way to the end. We give you a shout out at the end of every single show.
No.
Yep, and I'm going to. We'll do that right now. We're going to take off. Dr. Scott, you got anything else?
No, hey, thanks so much, Rob.
Thanks. Always go to Dr. Scott.
Thanks, guys.
The great Rob Bartlett. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, That Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, Rob. We send a shout out to her every time. Roland Campos, sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, the great Rob Bartlett. That's where yours goes.
There you go.
Wow.
Yep, there you go. Casey's Wet T-shirt, Carl's Deviated Septum, Patty C Cups, Bernie and Sid. How about that? Are you still friends with them, or do we like Bernie and Sid?
I haven't spoken to them in quite some time.
Okay, they had me on their show, and matter of fact, the drop at the beginning of this show is from Bernie and Sid. I'll play it again. Hang on.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Does that give you Spilkus hearing that voice again?
I just curious why I'm behind Roland Campos and Dennis Falcone. But perhaps I should be happy that at least I'm ahead of Casey's Wet T-shirt.
There you go. Casey's Wet T-shirt is quite awesome, by the way. Martha from Arkansas's Donner, Ron Bennington, and Fez Watley, whose support of the show has never gone unappreciated. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM, channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. And go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Yay.